More U.S. states are easing coronavirus restrictions as health experts warn the fight isn't over yet. A statewide mask mandate will be lifted in Texas Wednesday, and businesses are set to reopen at 100% capacity. In New York City, Mayor Bill de Blasio announced public high schools will resume in-person learning later this month. But there are mounting concerns. Restrictions are being lifted too quickly and could trigger another surge. There are now more than 29 million confirmed cases in the U.S., and more than 527,000 people have died. But on the vaccine front, the U.S. is averaging more than 2 million shots a day. More than 61 million people have received at least one dose. Over 32 million are fully vaccinated. Jonathan Vigliotti begins our coverage in Los Angeles.
Tonight, there may be trouble in Texas. The state set to reopen tomorrow. All businesses, including restaurants, able to operate at 100% capacity.
No more 6 people in the store waiting in a line outside. So silly. Done.
But it comes as the Houston Health Department issues this warning. The highly contagious UK variant has been found at 31 of the city's 39 wastewater treatment plants.
There is a fairly large amount of the UK variant in our community, and it is spreading.
Texas ranks 47th out of 50 for vaccinations in percent of population that's received at least one dose.
I worry we're in for the perfect storm. We're lifting restrictions, the B117 variants here in a big way, and we're lagging behind on vaccinations. None of that is good news.
It sounds like what you're saying is it's dangerous at this point.
I don't quite understand the urgency to lift restrictions.
Businesses and schools in Texas are still allowed to require masks, but one school district outside of Houston has already voted to make them optional.
It just doesn't make sense to cover our faces and not be able to breathe.
Here in California, just 2 months ago, LA hospitals were at a breaking point with patients in the hallways and no ICU beds. Now, LA County hospitalizations are down 86%, and average new cases have plummeted 92%. Masks are still mandatory in the Golden State. This Uber driver who asked his passengers to comply was assaulted and coughed on in San Francisco. Police are investigating. But tonight, there is optimism for better days ahead as the vaccine rolls out and sleeves roll up.
It's been a year, and it's just nice to see light at the end of the tunnel.
And the CDC is reporting what a lot of people have already experienced. Among those who are reporting side effects from the vaccine, most of which are mild, women make up nearly 80%. Elaine?
Jonathan Vigliotti, thank you. Infectious disease expert Dr. Amesh Adalja joins me now. He's a senior scholar at Johns Hopkins University's Bloomberg School of Public Health. Welcome, Dr. Adalja. So states like Texas are lifting restrictions, but as we just heard, variants remain a threat. Do you believe state officials are moving too fast?
I think what you have to do is separate two actions that some states are doing. One is increasing capacity at restaurants and stores, and the other is removing mask mandates. So I think if you're going to increase capacity at restaurants and stores, you need to keep the mask mandate in place, the way states like Connecticut and Massachusetts have done. Masks are going to be with us for some time until we get enough people vaccinated that we don't have to worry about community transmission. We're going to get there. So I would urge states that are opening up, go ahead and do that, but keep the mask mandate in place because we know that that's going to make all of that reopening much safer. And businesses that are in places where there is not a mask mandate, they should keep their employees, keep their customers wearing masks because it makes it safer from a business operations standpoint. So hopefully people will continue to wear masks despite what a governor may or may not do.
Well, more than 32 million people are now fully vaccinated in the U.S. That's just 9.7% of the population. From what you've seen, Doctor, what's been working in this process and where can the U.S. do better?
I think what we've seen working is when states are very innovative, where they're not necessarily thinking about all of the different priority groups when they're just trying to get vaccine into people's arms. So if they've got leftover doses, they're being innovative to make sure that those vaccines are not wasted, that they're really taking the vaccine that they get, and they're putting as many first doses into people as possible. That's where we've seen states really succeed. What needs to be better is we need it to be easier to sign up for a vaccine. If you're an elderly person and you have to have 6 websites open and keep refreshing like you're looking for Madonna tickets, that's not something that's easy for people to do. And we need to make this as easy easy as making a restaurant reservation or getting concert tickets or Hamilton tickets or whatever it might be. It's very hard to get a vaccine. And I think that tenacity is not something that we expect our elderly to have. So I do think we have to do this better, and I think we can do it better, and it's getting.
Well, President Biden's coronavirus relief plan will include billions of dollars in funding for a nationwide vaccine program. So far, individual states have handled their vaccinations. So how might we benefit from a nationwide approach?
I do think that what you find is that states have really been left on their own early on, especially during the Trump administration. It's gotten better with the Biden administration. But what we need to happen is states have the resources to be able to set up vaccine clinics, to have people that are able to administer vaccines. We need to get special public service announcements to hard-to-reach populations, those that might be vaccine hesitant. We really just need to have this be an all-out war effort with all the stops pulled out.
Well, a new study published in the New England Journal of Medicine Monday found that Pfizer's coronavirus vaccine neutralized the more contagious variant first found in Brazil. How significant, doctor, is that finding?
I think it's a major finding because there have been these variants that have been appearing, and there are several of them that are concerning, including the one from Brazil, including the one from South Africa. And what we're now learning is that our vaccines are going to likely be robust against them. We already know that the vaccines are able to stop what matters when it comes to serious disease, hospitalization, and death. But this news that the Pfizer vaccine is able to neutralize this variant is really heartening, because this was something that people thought might need to have a vaccine update. So I do think this is really good, and I think we'll find more of our vaccines are able to do this. Probably the Moderna has that same ability as well. I think it's important to test, and it's important to prepare for variants that might be difficult for vaccines. But so far, the variants don't seem to be something that I think will cause much problem when it comes to our vaccines, because they are able to stop what matters: serious disease, hospitalization, and death.
Well, finally, doctor, a CDC report found 78% of people who were hospitalized for COVID-19 were overweight or obese. How is this angle regarding weight key in the fight against the pandemic?
So we've known for a long time that many respiratory viruses do tend to prey on those who are overweight and obese. When people have those conditions, they have less physiologic reserve, they may have decreased lung capacity, and it's also a metabolic disorder when you're obese or overweight. And this really underscores the need for those individuals to be prioritized for vaccines, that they should be considered high-risk individuals. And as we get more of them vaccinated, I think that will have an impact on hospital capacity. So if you're overweight and obese, you should be somebody that's trying to get a vaccine, because you are at risk for severe disease.
All right, Dr. Amesh Adalja. Doctor, thank you very much.
Thank you.